How well you can talk with your doctor is an important part of making sure you get good health care. But talking with your doctor isn't always easy. Dr. Sherry Howell, a family practice physician, joins us now. Thank you for being with us, Dr. Howell.
Well, thanks for having me.
So we talked with Dr. Kunzweiler about being prepared for emergency room visits as a patient. But what should I do as a patient to be better prepared when I go to see you in an office setting?
Well, first of all, I think it's really important to be prepared so that your doctor can help you get the best medical care. So part of being prepared is having a list of your concerns or questions and then prioritize them. So make sure you have the number one concern on the top and start at the top and work your way down. If you have a long list and you know that going in, when you make your appointment, tell the receptionist that you're probably going to need extra time so they can schedule you for extra time. Otherwise, we're going to be trying to get through that whole list and everything's going to be really superficial. Don't be surprised if you have a long list, if you have to make another appointment and come back. So my record for going through a list has been 3 office appointments. So if you have a really complicated problem, we may get one problem done, and then you'll be coming back. So list of concerns and questions prioritized. Bring in a list of your medications, and also on that list of medications, put your supplements and vitamins. A lot of times we see people forgetting about those supplements and vitamins, and those play a role in your health care as well, and also can interact with your medications. So that's really important. If you wear a hearing aid, bring your hearing aid in your ear, make sure that it works. Because you're going to be asking your doctor questions, you need to hear what your doctor says. And you can't trust that I'm going to yell it loud enough that you're going to hear it and understand it. If you wear glasses, wear them, bring them with you. A lot of the stuff that I give my patients, I give pictures and tables and even things on the computer that they need to see. So if you don't have your glasses, you're going to be missing that part of the information. If you want to bring somebody with you to make sure that you have somebody to take notes or help you remember what was said, bring them with you. Anybody that you feel comfortable with, have them in the exam room with you. The other thing is if you're not comfortable in English, which is the only language I am comfortable speaking and hearing, bring an interpreter. So thus far I've had patients that have spoken German, sign language, Spanish. None of those are my languages. And when I went to Guatemala, we had patients that spoke in the native language, translated to Spanish, Spanish to English, and then back. So the translators can work really well. And then again, don't forget to ask questions. So if something doesn't make sense, ask the question. The other thing patients forget about is their insurance cards. And it's important, not just so that your doctor gets paid, but if you need additional tests like a CAT scan or an MRI, a lot of the insurance companies won't cover those tests if you don't have them authorized. So you got to get that test authorized, which means approved by the insurance company before it's done, or you may get to pay for that all by yourself, which would not be fun. The other thing that we see now is that patients who have medication coverage through a medication plan, those plans are getting more strict. So the medications aren't being covered as much, and so if you have cards for those plans, or even better if you have a formulary book that tells us what medications are covered. So we don't waste time delaying your medications for a day or 2 or 3 or 4, trying to get the one that's good for you.
So a lot of physicians are now using electronic medical records. Can you talk about some of the challenges associated with electronic medical records from a patient's perspective?
Well, I think the It's really interesting because I read an article in Ladies' Home Journal about how wonderful these are. But the big complaint is the doctor's not looking at you because they're looking at the computer putting the information in. So we do have scribes now. A lot of doctors use scribes, and the scribe puts the information in for the doctor. That way the doctor can spend more time with the patient. The other thing is that you can't depend on just because one doctor's using a computer and the other one's using a computer, that the computers are talking to each other. So if you're seen somewhere else, you need to make sure that your doctor gets the information from that other place. So your doctor's not a mind reader and the computers aren't talking. So get a copy of those records, bring them with you to your appointment.
And don't be too intimidated by the scribes as well. I'm assuming that's part of this as well.
Right. The scribes are just like a nurse or a doctor. They're trained. All of your questions and concerns are confidential. So what happens in Vegas stays in Vegas, right?
Oh, thank you so much, Dr. Howell.
Thanks for having me.
So if you're on Medicaid, Medicare, or both, or if you have a loved one who is, you'll want to stick around. We'll be right back.